With fruits and vegetables being increasingly described as mainstays to good health, it's no wonder more people are including fresh produce in their diets. Paralleling the rapid increase in sales and consumption of fresh produce over the last decade are increased numbers of foodborne illness cases, illnesses associated with the eating of such foods. Illnesses that are caused by microbial contamination can occur even from the time a crop is still in the ground, so the farmer is the first handler having responsibility for ensuring food safety. Then, in the journey from farm to table, fresh produce is exposed to several threats from contamination. Every person at each step in the process must be vigilant at assessing and eliminating sources of contamination. The goal of this video is to provide owners and managers in the fresh produce industry resources to use for health and hygiene training for handlers of produce in their farm or packing house facilities. The idea is to instill an understanding of how foodborne illnesses spread while providing strategies to prevent such spreading. Apply the information presented, and you'll be providing a consumer product that's harvested and packed in a safe environment. And as we proceed, we'll be providing current, research-based information about maximizing overall produce quality and safety. This information comes from the FDA Guide to Minimize Microbial Food Safety Hazards for Fresh Fruits and Vegetables, the 2001 FDA Food Code, the Good Manufacturing Practice, or GMP, and the University of Florida Produce Safety Training Manual. A foodborne illness can bring major financial losses to your food production operation. Remember, reasonable care is a key term to avoid being cited as negligent. As a manager of farms or packing house facilities, it is your responsibility to make sure your company is in compliance with rules and regulations. Rules developed by regulatory agencies will help your employees do their part in providing the freshest, safest produce possible. Following these rules is a responsibility they have to a worldwide marketplace as well as to your operation. More than one produce or food processing firm has closed following the outbreaks of illnesses that are traced back to the processor. The rules that are applied to avoid such outbreaks require an understanding of worker health and hygiene and of sanitary practices needed to maintain a high standard of cleanliness. Produce handlers can help prevent or reduce the chance of contamination occurring for nearly all foodborne illnesses by following safe produce handling procedures. Remember, we're all responsible for produce safety. Produce most likely to be consumed raw, those that are fresh and those that are minimally processed or fresh cut, are of special concern in terms of food safety and food security. That's because they're so widely consumed and because they don't receive kill treatments for any would-be microbial contaminants. The special concern also applies because of a presumed innocence. Fresh fruits and vegetables are not typically thought of as carriers of pathogens, so few cautions have traditionally been observed while handling them. Applying cautions to produce as it is harvested is the first step in reducing the incidence of foodborne illness. By reducing chances of contamination before produce leaves the field, growers reduce the overall occurrence of contamination as produce is packaged, shipped, stored, and ultimately sold. Know your enemy, a rule in any combat situation, is a rule extending to fighting food or produce contamination. You'll need to know the three classes of food contamination: chemical, physical, and biological, and what's included in each class. Chemical contaminants include pesticides, cleaning solutions, and any unnatural chemical that comes in contact with food. Physical contaminants include glass, metal fragments, fingernail chips, hair, and any foreign object that comes in contact with produce. Biological contaminants are living organisms and are often invisible. Common biological contaminants include bacteria, viruses, and molds. Major foodborne illnesses come from biological contamination, and of the biological contaminants, it's bacteria that cause most foodborne illnesses in produce. Many types of bacteria exist, and some may cause more severe illnesses than others. Viruses are a form of biological contamination that multiply only in living cells. The most common foodborne viral illness is norovirus, but the most serious is hepatitis A, both of which are transmitted by an infected person who handles food that requires no further heating, such as fresh produce. Although the list of biological contaminants can be long, the objective of this video is to focus only on worker health and hygiene and foodborne illnesses that can be transmitted through foods, specifically produce, and from people to people. Actively reducing the risk of contamination or spreading of major foodborne infectious disease depends on people applying cautions both on and off the job. Whenever someone eats food or produce containing high enough numbers of live germs, such as bacteria and viruses, enabling them to grow inside the body, that person is experiencing a food infection. Once that person is infected, they can spread the infection to others by contaminating foods or through person-to-person contact. A critical issue helping to prevent the spread of that infection involves good worker health and hygiene, because good hygiene practices can help or reduce the spread of food contamination. Some of the frequently cited biological contributing agents for outbreaks in fresh produce in recent years have been Salmonella, Shigella, E. coli O157H7, hepatitis A, which is a virus, Cyclospora, and Cryptosporidium, which are parasites. Within that list, it is cantaloupe, lettuce, tomatoes, and cabbage that can be most prone to food infection through the bacteria called Salmonella. In addition, scallions, basil, and parsley have been recently implicated in outbreaks with various biological contaminants. E. coli O157H7 can contaminate foods through fecal contact and has been tied to cases of illness from cantaloupes, lettuce, and cabbage, for instance, when it is used in coleslaw. Sources of microbial hazards include soil, water, manure, and other animal fecal contamination and human waste. It's important to remember that contamination can occur at any step from the field to the consumer. Good worker health and hygiene is critical to preventing foodborne illness. Maintaining good worker health and hygiene requires a sanitary facility and workers who are healthy, practice personal cleanliness, and to refrain from personal behaviors known to spread sickness. The American College of Occupational and Environmental Medicine recommends the following simple steps for controlling infectious diseases. Education, how infectious diseases spread. Infection control techniques, hand washing, cleaning and disinfecting, food handling and preparation. Lifestyle, vaccinations. For relevancy to the farms and packing house facilities, we will focus on familiarizing managers with selected personnel health and hygiene as related to the FDA, GAPs, the GMP, and the FDA 2001 Food Code. Additional information and materials are provided in the University of Florida Food Safety Manual. To prevent contamination, it's necessary to know how bacteria are spread. Common culprits involved in the spreading of infection include unwashed hands or contaminated gloves, sick employees, employees with open cuts and scrapes, employees who touch their faces and mouths with their hands, employees who do not wash their hands after using the restroom, unwashed and poorly sanitized preparation areas, and soiled cleaning or wiping cloths. Coworkers and supervisors should know the health status of workers. Everyone in the operation should be familiar with signs and symptoms of infectious diseases, especially those transmitted through foods. What are signs and symptoms of acute gastrointestinal illnesses? Diarrhea, fever, vomiting, jaundice, which shows itself in the form of yellow eyes or skin color, and sore throat with fever. Employees with these symptoms should be excluded from contacting foods directly. Since workers experiencing these symptoms cannot be permitted near food handling operations, it's a good idea to consider assigning them to other tasks. Such alternative work would keep sick employees from attempting to conceal their illnesses. While a sanitary facility has a lot to do with its maintenance and level of cleanliness, it's the provisions within the facility for employee cleanliness that are more directly related to preventing sickness. Make a plan for worker health and hygiene and then stick to your plans. Communicate your plans and rules to employees. Daily worker screening and inspection. A minimum screening of employees to detect if they have any of the following symptoms: diarrhea, fever, vomiting, jaundice, or sore throat with fever. These symptoms could pose an increased risk of contamination on produce and health risk for others. Training. A training and orientation on basic principles of health and hygiene, hand washing techniques, recognizing foodborne illness symptoms. Adequate hand washing stations. An adequate number of hand washing units should be available, and they should be fully stocked and easily accessible, no more than a 5-minute walk from where any employee is working. Instructions for proper use should be prominently posted. Toilet facilities in the field. An adequate number of toilet facilities with hand washing units should be available, and they should be fully stocked and easily accessible, no more than a 5-minute walk from where any employee is working. Instructions for proper use should be prominently posted. One facility is required for every 20 employees. Employee accommodations. Provide a clean area designated for employees to eat, drink, and use tobacco. Lockers or other suitable facilities to accommodate employees should also be provided. Other alternative hygiene products. When disposable gloves are provided for employees, the employees must be trained to use the gloves properly. Even though hand sanitizers can be used, they are by no means a replacement to proper hand washing. Should a hand sanitizer be part of an operation, it needs to be one approved by the FDA. Remember, if employees are well trained and they have means to practice, chances are they will practice personal hygiene. Personal cleanliness should be maintained by anyone having direct contact with produce. It is achieved by showering, hand washing, brushing teeth, and by wearing clean clothing. Where personal cleanliness involves the positive things we should be doing, the personal behaviors that could impact the purity of foods include actions that should not be permitted near the operation. These include smoking, spitting, chewing gum, eating, sneezing, or coughing on foods. Safe personal hygiene is everyone's responsibility, and since thorough washing of hands is such an important part of it, we're going to take a look at the steps involved. You'll need a wash sink having hot water, hand soap, a small fingernail brush, and paper toweling. Before starting, remove rings and other jewelry from the hands and wrists. Then, dispense a small piece of paper toweling. It's important to do this before applying water to your hands and place it within easy reach of the sink. Now, turn the hot water on, apply soap to the hands, and rub them together vigorously under the running water for at least 20 seconds. A suggestion would be to count in increments of 1,000, like 1,001, 1,002, all the way up to 1,020. Be sure to include the backs of the hands and all exposed areas. Don't forget the wrists and the areas between the fingers. Fingernails are areas where bacteria love to hide, so thorough hand cleaning requires thorough nail cleaning with a small brush. After all areas have been washed with soap and water, rinse the soap off. Then pick up the paper towel that was set aside earlier and use it to turn off the faucet. It's necessary to avoid touching the faucet handle directly because now these hands are clean and the faucet handles are not. This same towel can also be used to dispense more paper toweling, and the freshly dispensed towels can then be used to dry the hands. If the employee has cuts or opened wounds, this would be the time to replace bandaging. It should be replaced frequently after assuring that the wound is clean and dry. While disposable gloves have their place, they may not be used as a substitute for hand washing. They should be put on only after the hands are clean and changed often. This should be done every time a person changes activities during the workday. As we have seen, practicing clean personal hygiene may be the most important quality that you and your employees can convey to others about yourself and the company you work for. It's important that you make sure your employees are washing their hands properly before returning to work, or washing their hands frequently throughout the day while they are working. By doing so, they're helping to ensure the continued success of their company and their job security. Your attention to the importance of personal hygiene, as well as other topics covered in this video and detailed even further in the University of Florida Produce Safety Training materials, is greatly appreciated by your company and ultimately by the customers who purchase your produce. With your commitment to safe food handling procedures, you are helping to ensure the success of your company and the fresh produce industry.